Hello anatomy students and welcome to AMT. Today we want to take a quick look at the functional anatomy of the bones of the skull. This information you will later use it in the management of victims of trauma. For example, in ballistic trauma, people present with gunshot wounds and also fractures that occur during road traffic accidents. So it is of paramount importance that each and every health professional knows the functional anatomy of the skull. If you haven't yet subscribed to this channel, please, I beg you to hit the subscribe button and the notifications button so that you can be notified when we upload a new video. So the skull is the skeletal part of the head and neck, and it is a highly modified region of the axial skeleton. It is of mesenchymal origin and it consists of 22 bones. But I want you to take note of the fact that this number excludes the ossicles of the ear. The first bone that we want to look at is the frontal bone. This one is joined to the posterior bones via the coronal suture. So the coronal suture and the coronavirus have got something in common in that they both resemble a crown. Here there is a foramen, which is an opening through the bone, which is above the orbit, and we call it the supraorbital foramen. Here there is this line that you can see, it's called the frontal suture. The prominence there is called the glabella. And as you can see, the frontal bone forms the roof of the orbit. Here laterally it is joined to this bone called the zygomatic bone, and this part is called the zygomatic process of the frontal bone. On the side we can see this line which extends to this part. It is called the superior temporal line, and it forms the upper border of the temporal fossa. The second bone that we're going to look at is the parietal bone, and it is paired, meaning to say from the other side we've got the parietal bone, and they are joined together at the center by a suture that is tortuous, and we call it the sagittal suture. So laterally we can see the continuation of that line, which is the superior temporal line, and it forms the upper border of the infratemporal fossa. The third bone is the temporal bone. This one has got two major parts, which is the squamous part and the petrous part. Petrous means hard, right? So this part that you can see, the extension here, articulates with the zygomatic bone here. So we call this the zygomatic process of the temporal bone. We've got an opening here called the external acoustic meatus. So here is an isolated temporal bone. We've got the brown part called the squamous part, the part in yellow called the tympanic part, the part in green called the petrous part, and here we've got a process called the mastoid process and another one called the styloid process. So if you want to remember the styloid process, just think of the stiletto. When someone wears a stiletto, they've got style. So styloid process. The depression here is called the mandibular fossa because it articulates with the condyloid process of the mandible. Together they form what is called the temporomandibular joint, which is the only movable joint in the skull. The opening here is called the external acoustic meatus, and here inside we have got the internal acoustic meatus. So this is the point where the facial nerve enters the facial canal on the medial wall of the middle ear. The next bone that we are going to look at is the occipital bone, which forms the most posterior aspect of the skull. it has got one most prominent feature called the foramen magnum. This huge opening is where the spinal cord begins as a continuation from the medulla oblongata. Lateral to it, bilaterally, there is this feature called the occipital condyle. This articulates with the first cervical vertebra called the atlas. In front of the condyle is the hypoglossal canal, and posteriorly the condylar canal. Here we can see the cruciform eminence at the center, the depression for the superior sagittal sinus, the depression for the transverse sinus, and the depression for the occipital sinus. Again, the hypoglossal canal, the condylar canal, and the foramen magnum. This part is called what? The occipital condyle. Posteriorly, we have got these markings, the external occipital protuberance here, and then below we have got the inferior nuchal line, the superior nuchal line, and the highest nuchal line. These are all the features for the attachment of muscles that we are going to do in the next video. For example, the superior nuchal line is where the trapezius attaches. Now we want to look at a bone that is very interesting. This bone touches almost everything in the skull except the lacrimal bone and the mandible. And this bone is called the sphenoid bone, indicated here in yellow. The sphenoid bone is quite interesting in the fact that it perfectly resembles a butterfly. Its main body parts include the body, which is in green, the two wings, the first being the lesser wing in brown, and the greater wing, and what I would like to call the legs of the butterfly, which are called the pterygoid processes of the sphenoid bone. As you can see, there are many processes called the clinoid processes. Here, as an extension of the lesser wing, are the anterior clinoid process, the middle clinoid processes, and the posterior clinoid processes. Here the depression is called the sella tussica. Sella tussica is a Latin for Turkish seat, which resembles a saddle. So it seems like someone is going to ride this butterfly, and who is that person? It's the pituitary gland that stays here. Let's take a quick look at the legs of this butterfly. These are what we call the pterygoid processes of the sphenoid bone. On each side there are two. The medial one is called the medial pterygoid process, and it has got an extension here called the pterygoid hamulus. The lateral one is called the lateral pterygoid process. The depression in between is called the pterygoid fossa. All these act as the attachment of the muscles of mastication called the lateral pterygoid muscle and the medial pterygoid muscle. The depression, which is the pterygoid fossa, and the lateral wall of the medial pterygoid process are for the attachment of the medial pterygoid muscle. The medial wall of the lateral pterygoid process are for the attachment of the lateral pterygoid muscle. The sphenoid bone has got many foramina, which act as passage of very important structures like blood vessels, nerves, as they pass from the cranium into areas like the face. So here we are going to name each and every foramina on the sphenoid bone and give examples of the structures that pass through. But please take note of the fact that we have got another video that you need to watch for the details of what passes through each and every foramina, and there we have got some mnemonics to help you remember. There is a slit in between the greater wing and the lesser wing of the sphenoid. This is called the superior orbital fissure, and this is where structures like the ophthalmic division of the trigeminal nerve passes through. and other structures. Here we've got the optic canal. That's where the optic nerve passes through to the orbit. Laterally, we have got the foramen rotundum, which leads to the pterygopalatine fossa, and it acts as a passage for the maxillary division of the trigeminal. Laterally, we have got the foramen ovale. This acts as the passage for the mandibular division of the trigeminal, and lateral to it, we've got the foramen spinosum, and this acts as the passage for the middle meningeal artery. The last bone that we're going to look at is the ethmoidal bone. This is indicated in pink, and it is found posteriorly to the lacrimal bone. This is how it sits inside the human skull. This is the anterior part, and this is the posterior part. The prominent feature here is called the crista galli. This is where the falx cerebri of the brain attaches. It has got many sinuses from the anterior to the posterior ethmoidal sinuses. This part indicated in dark green is called the anterior ethmoidal canal or anterior ethmoidal foramen. This part is the posterior ethmoidal foramen. These act as passage of the anterior and posterior ethmoidal nerves and vessels. On the underside of the ethmoid bone, it has got a perpendicular plate which forms the walls of the nose, and on the lateral sides it has got a spongy bone that is arranged in layers called conchae. So we've got the superior, middle, and the inferior nasal conchae, and these act to direct the air that we breathe and also warm it. And that's it, folks, for the osteology of the cranium. Please watch out for part 2. We'll be looking at the foramina of the skull. We'll be looking at the details of each and every structure that passes through it. And if by any chance you find this video helpful, please click the subscribe button and hit the notifications button so that you can be notified when I upload a new video. Thank you.